Hello everyone. As I said yesterday in this video, I'm gonna show you an interview. This person in the interview is a doctor. He was treating the very first few cases of coronavirus patients back in the end of December. 11 days after he was charged by the government of spreading the rumors, he was infected by the virus himself. When this interview was done, he was still in the hospital, and they communicated by typing because he couldn't talk properly. I'm gonna walk you through the content of the interview because I didn't translate them properly. I'm not, a journalism student. I'm not an English major student. I didn't take the time and effort to translate them word by word. I'm just gonna walk you through roughly so that you understand what he's saying. How do you feel? Dizzy? How did you know the hospital emergency department had 7 patients with unexplained symptoms? I was told by the colleagues at night. I saw a red-headed document. I showed you this document in the first video. The government emphasized especially they can't spread the news to anyone. If you remember, I also showed you some screenshots in that video. One of the screenshots was exactly by this doctor. He was telling his colleagues in a WeChat group that you should not spread the news, which I think he said he repeatedly emphasized in the group not to spread the word, but it was still screenshotted. Either this is not university classmates. He meant that at this time he was posting in the WeChat group. This is a WeChat group. It's a screenshot and you can find in the first video. So you've been punished for taking screenshots. I received a phone call asking to go to have a tea. We call that have a tea. He repeatedly asked me about the source and if I realized I was making a mistake. Later, I was asked to write a self-reflection and self-criticism of untrue information. This is such a classic in China. If you were found, by someone there who thinks that you made a mistake, you have to reflect yourself and criticize yourself. I personally really hate that, but it's such a classic. Anyway. Did the hospital later remind everyone not to spread the news? Are there any penalties for posting information? Yes, it is required. Not on the internet, not orally. Later, after the epidemic apparently spread, because I personally treated such patients and her family members were infected, and I was also infected. Is there any isolation measures? They were isolated in a single room in the ward. Our doctor started to wear the mask, but when the patients did not have fever, we did not wear masks. So they were not really, they didn't really realize the seriousness of this virus. From person to person, we weren't sure at the time, but the family members who took care of the patient soon became feverish, and the night when the patient became feverish. Later, the patient family members went to the respiratory isolation ward on January 10th. Obviously, by this date, they already know that it can be passed from person to person. When did you feel unwell? I started coughing at noon. Has the condition improved since entering intensive care unit? Do other colleagues in the department have a similar situation? 2 of them. How well did the medical staff protect themselves while in the ward? They do wear the mask and gowns. They also know that their protective measures are not enough, but they're still doing treatment normally. It is natural to worry about being affected, but this is work, and the patient is the colleague who get along with him. I feel really sorry for this guy. I mean, like, one of the patients is a colleague. It means that the infection between the patients and the doctors, or like the nurses, the medical workers, are pretty serious. After switching to respiratory department, protective measures were perfect. Wearing protective clothing on Google's. Does it cost money? There's no urgent fees for the time being. The government says it will cover the cost of treatment. However, I used a lot of blah 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 and bought them. Okay, I mean here, when you're talking about costing money, it actually would cost you less in China compared to, for example, the U.S. medical system. As we all know, the U.S. medical system are really expensive without the insurance. You're basically broken if you didn't buy any insurance in a situation like this. Relatively, the Chinese hospitals are better in terms of that, because the government will cover a large part of it. They kind of buy the insurance for you, but well, you still have to pay a certain percentage. But it really depends on what problem you're having. But anyway, it was not that bad. The problem with the medical service in China is less about the money. It's more about the amount of patients who's seeking for services, and the little stuff that they were able to, the limited service they were able to provide. That was the problem. Money was not the most important problem. Is there a normal meal supply in the hospital? Yes, it is distributed free of charge in the cafeteria. Nutrition is okay. Has the family been infected? My parents also developed fever and vomiting. That sounds really sad. I dare not tell them more about my situation. I mean, I feel pretty bad for this doctor. It's a huge irony that he was charged like 11 days after he was charged with spreading the rumors. He himself got the disease. It's kind of absurd, but like, if you think carefully, you would feel super sorry for him, because his family was also getting infected. There were not enough awareness, there were not enough protection beforehand, before everyone realized how serious it is. As you can see from his interview, he was saying that he was getting enough food, but this is not the case in every hospital in Wuhan now. I saw a post looking for help. It's a family member by a patient who got infected. He was saying that his mom couldn't get food in the hospital because they don't offer it to every patient. They have to rely on their family members to send the food to them. But the nurses was just too busy to feed her mom, because her mom couldn't eat herself in that situation. But the nurses had more than 30 patients to look after. She really didn't have time to feed her mom, and she was looking for help, trying to give her mom something to eat, because she herself couldn't enter into the ward, with the isolation ward. It's everything just sounds really terrible, but I feel like it is getting better these days, after the government was sending like more staff to help in Wuhan or in the whole Hubei province. I do really hope that these people get the treatment, get their food, get what they need as soon as possible. Like, I do hope both the patients and the medical workers are in better conditions, so they will be able to get better, rest properly.